Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. So why I developed specialized treatment programs for patients? First, to provide highest quality care at affordable price for patients who cannot fly or drive to see me in the clinic. These programs constructed to provide the best outcome with treating yourself at home. It's a step-by-step program, and I go through the entire treatment protocol that I usually do with my patient in the clinic. It's about an hour and a half each program, easy to follow, and everything you need to know to treat that body part. And if for example, knee, hip, back, shoulder. So I go over what you need to do for this condition to relieve your pain. So the programs includes ergonomics exercises related to that body part, behavior modification, anti-inflammatory diet. Also, a step-by-step how to use ASTR tools to treat that body part. The typical success rate usually mid-80 to mid-90. There's two options for the programs. The first option is to sign up just for the online course, and that's give you access to the information, the videos, and the handouts for that body part. The second option is signing for the online course plus the toolkit that used for that body part. So we usually recommend for patient the first time you sign up for the body part with the kit. For example, if you have back pain, you just sign up for the online course and the back pain kit. When you get the kit, you learn how to use it for that body part. In case in the future, if you have issue with the shoulder, with the knee, with the ankle, you don't need to buy the kit again. You can use the same kit. So you just sign up for the online course for the knee and for the shoulder. So this way you just access the information, but the kit, you can use it again. So by implementing the entire program, the expectation that you get back to normal 100% in 2-week periods. In case you have not achieved the 100% back to normal in 2 weeks, there is a sign that could be a sign that you have nutrition deficiency, vitamins, mineral, hormonal imbalance, or other issue that need extra evaluation. That extra evaluation is not included with the course. That's why we offer an option to have a private Skype session or phone evaluation with me to figure out why you are not healing. And during this session, I usually go over blood works or maybe requesting more testing to figure out why you are not healing. So the goal is actually to achieve long-term pain relief in just a short period of time through these programs. So if you have any question, you can give us a call or email us and we'll be happy to answer your question. Looking forward to work with you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!